Good afternoon. My name is Jennifer Sherfield, and I am a forensic interviewer and social worker at a child advocacy center in Columbus, Ohio. And along with my colleague, Gail Horner, who's a nurse practitioner, we did some research looking at commercial sexual exploitation of children and what their healthcare utilization looked like. So we know that CSEC is a growing epidemic. It's very provocative. You're hearing about it everywhere. What we don't see is a ton of research that highlights what healthcare utilization looks like, particularly with youth in this population. And above and beyond that, what are some of the psychosocial risk factors that might present in a hospital-like setting? So what we wanted to do with this study was really describe what healthcare utilization looked like, what were some of the familial psychosocial risk factors that were present, the specific child sexual abuse case characteristics, and any patient demographic characteristics of adolescents prior to the time of them being identified. So along with my colleague, we did a retrospective chart review for all adolescents, that presented to either our emergency department or our child advocacy center for concerns or allegations of CSEC over a 26-month period. And we reviewed those charts. We had kids present from law enforcement, from children's services, from the court. And it was either in trafficking specific situations picked up as part of a sting, or kids who had been AWOL for 2 months and there were some concerns about what they were doing at the time that they were gone. So we farmed out our data analysis because it was not either of our skill set, and they really looked at descriptive statistics to analyze the data and then determine some of the frequencies along with some of those variables to figure out what the percentages or where there was things that needed to be identified. 98.4% of the youth identified in our study were female, 54% being African American. Most were identified as female. We had only one male the entire time. We saw an overrepresentation in our African American youth population. We looked specifically at sexual activity descriptors and saw that age of initiation into sexual activity for most of the adolescents in the study, about 58.7%, was around 13 to 14 years old. And 1/3 of all the adolescents in our study reported having 10 or more sexual partners. So all things potentially increasing risk. When we looked at presentation with the pediatric health hospital, the age at first presentation for care at Children's Hospital was 9 years old, ranging from 2 to 17, and nearly all of the adolescents in the study, so 82.5% identified, received care within a year of their identification as a trafficking victim or at risk for doing so. 93.6% of all the adolescents identified had a mental health disorder, the majority being diagnosed with a mood disorder, engaging in self-harming behavior, or reporting concern for suicidal ideations. Over 2/3 of the adolescents in this study had positive STI results. On at least one occasion, we had one youth that had 11 positive STI tests throughout the course of her time with us. Urinary tract infections, pelvic inflammatory disease, and pregnancy were less common. Drug and alcohol use were high, some of the other risk factors that we've seen associated with trafficking. We really wanted to look at familial psychosocial characteristics too, so not just youth-identified risk factors, but familial psychosocial characteristics. And while there were some that popped up in terms of kids living out of care and parent substance use and exposure to domestic violence, what was more alarming was the amount of information that was unknown in our charts that we as medical providers and practitioners weren't gathering. So caregivers were involved with law enforcement, had children's service involvement. I said exposed to domestic violence with about 1/4 of our kids having witnessed it, but again, a large amount being unknown. We looked at prior sexual abuse history being a potential risk factor for CSEC, and about 40% of our adolescents had more than one sexual abuse assessment completed prior to their trafficking assessment, with some ranging from 2 to 8%. Some of the limitations were Oh, I'm sorry, I'm skipping ahead on slides. With some of the youth that we looked at for assessment, we referred 80% of them for trauma counseling, and only one of them linked successfully with the programming that we had at the hospital. So a huge gap in terms of services. As far as limitations, anytime you're relying on somebody else documenting information, you don't know that all the information is being captured. And so it was a huge gap for us because the information could have been present or known by provider, but it wasn't available to us through chart review. We had a relatively small sample size with 63, so there's some limited diversity. So we know CSEC is a pediatric healthcare problem. We know people involved in the medical field, whether you're social workers or providers, need to be aware of this issue. What we found was that we had a significant amount of kids that could have potentially been identified if our staff was better educated, if they knew what the risk factors were, and we would have been able at those points to intervene and provide just better outcomes for them. Thank you.